Hi, I'm Dr. Scott Taylor. The first thing I want to say is please be sure that you're buckling your children up and using the proper size car seat for your child. 40% of all fatalities of children in car accidents happen because the child was not in the correct car seat or was not restrained at all. 40% of children could have had their lives saved had their parents made sure they were properly buckled in the right size car seat. All car seats have recommendations. They tell you which height and weight the seat is good for, how old kids can be before they start using a rear-facing seat versus one that faces the front, versus a booster seat, and even versus sitting in the front of the car. I know all cars have a disclaimer saying the back seat is the safest place for children. If you do get in a car accident, I hope you're seeking care and are bringing your children with you. If you found this helpful, please share and like and leave a comment. We'd be happy to discuss this further and answer any questions you might have. We'll talk soon. Thanks. In our clinic, when necessary, we take x-rays of our patients. We don't want to miss anything, and if it's going to provide more clinical information to help us treat that patient, it's of good value to us. Some patients are concerned about radiation coming from x-rays, but the amount of radiation you get from an x-ray is very small compared to other sources. Your microwave, flying in an airplane, a lot of other things can generate more radiation than a simple low-back x-ray. And we use a very low dose. Our goal is to help our patients. If x-rays are going to give us information we need to do that, we want them. If you found this helpful, click like and share, and please comment. We'd be happy to communicate with you. We'll talk to you soon. Thanks. Everybody knows you should wear a seatbelt, but why? Do you know how bad it can be if you don't? Hi, I'm Dr. Scott Taylor. They've done a lot of research on seatbelts, and that's why it's the law that you buckle up. Click it or ticket. It's been shown that a seatbelt increases the safety efficiency by 42%. To get an idea of how much that can help you, picture yourself driving down the road at 25 miles per hour, which is not that fast. That's just driving around town. If your car is traveling 25 miles per hour, that means you're traveling at the same speed. If the car comes to an abrupt stop because of an accident and runs into a pole, your body will continue to travel at 25 miles per hour until something stops it. Hopefully it's an airbag or a seatbelt. But if you're not wearing a seatbelt, traveling at that speed and hitting something would be equivalent of you jumping off a third-story building and hitting the concrete. Other research has shown that wearing a seatbelt harness or strap across the chest actually increases the likelihood of having whiplash. That's because it stops the chest while the head continues to move forward, but it's going to save your life. Whiplash is something we can treat in the office and hopefully fix it for you, but we can't bring you back to life. So please wear your seatbelt. If you're involved in a car accident and have whiplash, we can help you. Other clinics can help you too. Reach out to us. Leave a comment if you need to find a doctor in your area, or if you have any other questions, we'd love to hear from you. Thanks. Can you get adjusted while you're pregnant? That's a common question we get in our clinic. Hi, I'm Dr. Scott Taylor. We see a lot of patients who are pregnant and have had a lot of back pain. The reason they have back pain is because there are a lot of changes going on in their body. Their center of gravity is shifting as the weight is added to the body, and different hormones are being released that cause the ligaments to be a little more loose and relaxed. The good news is that they can be adjusted, and they should be. We treat a lot of pregnant patients in our office, and they've said that getting adjusted through their pregnancy has relieved a lot of their back pain. Adjustments during pregnancy also speed up labor and delivery times and ensure the baby is in a good position. Getting adjusted keeps mom and baby happy, especially towards the end when things are getting quite uncomfortable. We get fantastic results with these patients. If you like this, share it and leave a comment, and we'll talk to you soon. Thanks.